Hello, everyone, and welcome to Momentum Builder. We're here with Val. She is one of the experts that we invited to be part of this event. And Val, we're going to start just with some simple questions. Again, thank you for joining us today. What inspired you to become a supervisor, mentor in our field, and how that has shaped your approach in guiding other clinicians?
Great question. I have loved and had a passion for play therapy since I became a therapist a decade ago. And I appreciate and value the models that we're taught as clinicians. And I am a neurodivergent person, so I do things differently. And I was um, really passionate about helping other clinicians to find their voice and the way that they do it, and not in a critical or shaming way, because I received a lot of criticism as a clinician coming up with different supervisors if I didn't do things exactly prescribed. So I started a practice and I do supervision from the lens of just being neurodivergent and recognizing that people take information differently, they experience the world differently, they need a variety of different interventions.
Yeah.
Kind of, what do you think are the most common challenges that therapists face, whether it's like a newer therapist that you're supervising, or
Mhm.
even more like a seasoned therapist that you may be providing like mentorship to? And like, how would you support them in overcoming some of those obstacles?
Ooh, the biggest one I'm thinking of is self-confidence, with a primarily female-driven field. We get a lot of what is like the imposter syndrome, like we're not doing it. So if we don't have the specialty or the credentials or the letters after our names, then there's this sense of devaluing who
Yeah.
we are and what we've already done and what we can contribute to the field. So my heart is to help them find their strength and their knowing and their drive with whatever their clinical practice is, and like embellish it.
Mm, I like it.
Yeah.
So, how does your supervision approach incorporates cultural humility and their responsiveness when working with a diverse supervisees?
Cultural humility. That's a good one. I am a really big fan of honesty and transparency and authenticity. So as a white cis, well, bi, but passing woman with privilege, I like to talk about that and acknowledge it and stay really, really curious about uh, what they're experiencing, what with me, outside of me, in the field, and tailor recognizing that all of the theories that we work with as play therapists are from white men in the 1900s, and adapting and coming and bringing it to a current culture, recognizing politics and privilege and socioeconomic status and all of the things that are really impactful, to a clinician feeling like they can make it in this world or make it in this clinical world
Mhm.
and sometimes in the world.
Yeah.
Yeah.
So expand on all your specialties and skills and why people should seek you out and what they could get from you. Like as a either whether a supervisor or a mentor or just a consultant.
Sure. Yes. Okay. So there's lots of credentials, and there is my heart valued is the certified autism specialist. That was the first certification that I successfully got many years ago. ADHD certified clinical service provider. I'm also certified in OP play, which is a specific kind of play therapy, and most recently certified as a mental health and nutrition clinical specialist, which I am very holistic and recognizing that all of these things go together to fuel our brain and our body, and it matters what we put in our body and how we're helping clients and mentees even to like fuel their brains and bodies. So I try to mentor and supervise from that lens where information is power, and the more you know, the better you can do, and the better choices you can make if you choose not to. So,
Nice.
that answer the question?
It did. For everyone
Okay,
out
good.
there, like she cooks so amazing. I still cannot stop salivating from the salmon from last time. Um,
I
Belle,
do
what
love to cook.
advice what advice would you give therapists looking for um, a mentor, a supervisor in order to enhance their skills?
I love interview processes with supervisees and mentees. And again, as someone who historically I've not been very vocal about being neurodivergent, embrace what you know about you and find a supervisor that fits with you.
Mhm.
And it should be okay to have an interview with your supervisor and you can
Yeah.
ask questions, and it is, you owe them nothing, they owe you nothing.
Mhm.
And if it's not a good fit, that's okay.
Mhm.
Um, Ask for referrals. And I know that, especially in play therapy, it can be really hard, or if you're specializing in different things, it can be more complicated to find a good fit, but make sure it's someone who you don't mind spending a lot of time in and that you would admire or at least know their work.
Yeah.
Um, yeah, you don't want to get in a situation where you're supervised by somebody and they're like kind of shady. Like, oh.
So, along similar lines to what Liliana was talking about with your salmon and cooking, what do you do to recharge and take care of yourself when you're not a therapist, when you're not a supervisor, when you're just a person?
I bake a lot. I am gluten-free and dairy-free, and I have a sourdough kind of obsession. So I love trying new recipes and making all kinds of fabulous sourdough. I made pancakes and bread and bagels this weekend. They were delicious, and I love to cook. I also like to read a lot, and I like to walk outside because we live in Colorado and it's gorgeous here.
It
It
is.
is.
We're lucky.
And I have a French bulldog who keeps me very busy.
Nice. Thank you for being here. Please, people who are watching this video, do not contact Val for her recipes. Do not contact her for her cooking. We are promoting, even though it came out here, her supervision skills. So thank you, Val, for being here, for saying yes to Momentum Builder, and for all your specialties.
Thanks for having me.
Bye.
Bye.